location. If this is in the face, this is either verrucous vulgaris or squamous cell carcinoma. So you should understand that a wart is a general term. Okay? So it will be the histology which will tell you ultimately whether it is benign or malignant. So by doing a biopsy. If it is in the vulva, it can be single warty lesion, or these are multiple warty lesion. And the first consideration will be condyloma accumulatum. So similarly, if it is warty, squamous cell carcinoma is one of the differential, especially if it is in the cervix or in the vagina. Whenever you have a colored lesion, it is malignant melanoma until proven otherwise. So what did we say will be the critical size of pigmented lesion? 0.6. This is more than 1 centimeter. Plus the ABCD, irregular boundaries. So it can involve the hairy portion or the skin. So in this example, the color ranges from gray-white to brown to dark brown or even black. So malignant melanoma is the diagnosis. This is subcutaneous aggregation of streaks, no? Hard gray-white streaks forming pseudo-tumor-like lesion. So if it is tumor-like, we call it topus. If it is gouty or gout, it is more diffuse. But the histologic term is your gout. So this is urate crystals. So notice that the overlying skin is normal looking. So in the breast, the benign fibroadenomas will be well circumscribed, unencapsulated. It is gray-white in this example, multinodular. It can range from 0.3 or 4 in this example, or large, just the whole thing. And characteristically shows you what we classically describe as lobulated cut surface. So if you will review your growth of the pancreas, this is similar to the pancreas on cut section. So lobulated cut section. In contrast, your fibrocystic disease is ill-defined. In this example, presenting as gray-white to pale brown, ill-defined lesion, soft to firm, smooth cut surface. You see those cavities, small cavities? Small cavities. Yan, that is a cavity.
Lokson po dyan.
And those green things are cavities. This one is cavity. So that is the main lesion in your cystic disease. Notice also that the tumor is alternating with adipose tissue. It is not well circumscribed lesion. Ayan, mga cavities yan. You see that now? Cavities. Those. Okay, so this is fibrocystic change. So the histology is important, no? As you know, the spectrum can range from simple cystic disease, which is the most benign, to your epithelial hyperplasia. So you have to see the latter microscopically. This is now invasive ductal carcinoma. It is ill-defined, pale brown, hard, And you have granular cut surface. It is not lobulated, ill-defined. And those blackish color are areas of necrosis already. Especially there is already infiltration of the skins. This is skin nipple. Infiltrating the skin ito. Do you see those linear streaks? Streaks or pale brown lesion. Ayan, streak. Those are the invasive streaks of cancer cells. Okay. So this grossly is meaty-like, similar to your leiomyosarcoma. Will be similar in your breast and in your uterus. So notice that the fibers are more elongated. Okay. So these cavities are areas of necrosis plus the hemorrhage. So this is an example of your phylloides tumor. Again, to determine whether it is benign or borderline or malignant will rest on the histology. No? Mitosis, overgrowth, pleomorphism of cells. By the size, if it is more than 5 cm, phylloides will be the consideration than fibroadenoma. If it exceeds 10, you have to consider already at least low malignant or malignant phylloides. I forgot to mention that this will behave as a sarcoma. And so the usual spread is vascular, hematogenous. And the management is simple mastectomy only. Do not include the lymph. Okay. And the last one is your mucinous carcinoma. So even in this view, notice that it is translucent, myxoid. So it is soft theoretically, but this is hardened already by the formalin. So it is irregular. That portion is gelatin-like. Ayan, yung clear. Mucin or gelatin-like. So all of this, ayan lalo na ito. Like this one. Mucin, gelatin are translucent. Okay? My hand is opaque. But when you see through, that is translucent. So this is translucent rather than opaque. All of this. Okay? I think this is the last one. I recommend that you examine them individually. And then we meet in 5 or 10 minutes for the microscopic